Chlamydia is a very common sexually transmitted infection all over the world. In fact, chlamydia is the most common STI in Australia. Chlamydia is caused by the bacteria Chlamydia trachomatis. Chlamydia is passed from one person to another during sex. This includes oral, anal and vaginal sex. Chlamydia can affect all people regardless of their sexuality, but is most common in young people. The majority of women with chlamydia infection have no symptoms at all. And the majority of men with chlamydia infection have no symptoms. Unfortunately, this makes it easy for an infected person to pass on chlamydia to their sexual partner without even knowing it. Whilst many women with chlamydia don't have any symptoms, those that do have symptoms such as vaginal discharge that is different from normal. Pain or burning when urinating, and urinating more often than usual. Pain during sex. Bleeding after sex. Pain in the lower abdomen or pelvic area. Rectal pain, itching, discharge or bleeding after anal sex. Or a sore throat after oral sex.
Most men don't have any symptoms, but when they do, symptoms include pain or burning when urinating, and urinating more often than usual. Discharge from the urethra at the tip of the penis. Pain or swelling of the scrotum and testes. Rectal pain, itching, discharge or bleeding after anal sex.
If you don't get tested, chlamydia could be living in your body without you knowing it. You may even get repeated infections. Both repeated infections and long-term untreated chlamydia increase your risk of serious health problems. For women, this may include infertility, infection of the uterus and infection of the fallopian tubes. Untreated chlamydia may also result in pelvic inflammatory disease, plus an increased risk of complications in pregnancy. If pregnant women have a chlamydia infection at the time of delivery, their newborn baby can also be affected.
For heterosexual guys who have sex with girls, chlamydia causes infection of the urethra. This may spread to involve the other tubes of the male reproductive tract and the testes. Gay men can also get chlamydia through anal sex. Chlamydia can even be passed between partners during oral sex, affecting the throat. Men can also experience infertility as a consequence of long-term infection and scarring.
Luckily, testing for chlamydia is as easy as giving a urine sample. If you already have signs and symptoms of chlamydia or have a sexual partner with chlamydia, the doctor or nurse may request a swab instead of a urine sample. For women, this means taking a swab of the cervix. To do this, the doctor or nurse will need to do an internal examination using an instrument called a speculum. This allows the doctor or nurse to see the cervix more clearly. You can request a chlamydia swab when you get a pap smear.
For men, a swab will be taken from the urethra. Swabs can also be taken from the anus and throat. Chlamydia is easily treated with a course of antibiotics.
Condom use during vaginal, anal or oral sex is the best way to reduce your chance of getting chlamydia. And having a thorough sexual health check, if you have any unusual signs or symptoms, as well as every time you have a new sexual partner, will mean chlamydia or any other STI can be picked up and treated with the right medication. Remember, help is always available from your local doctor or sexual health clinic.